Hi, my name is Mohit Kaushal. Today I'll be demonstrating how to give IV meds via Minibag. Okay, so the first thing I'll be doing is comparing my physician's order to the MAR, but I know my physician's order have already been transcribed onto my MAR correctly. So right now we're just going to be looking at our patient. We're just going to be checking the MAR. Today we're going to be caring for MR Wrightson. Her fin is 1, 2, 3, 4, 5, 6, 7, 8, 9. She has no known allergies, and she is currently admitted to the hospital because her cat scratched her on her left arm, and it is increasingly getting sore and red, so therefore she has cellulitis. And okay, so the medication we're giving today is cloxacillin, 1 gram IV every 6 hours. And okay, so I'm just gonna be doing hand hygiene and pulling out my medications. And over here I have my cloxacillin. It's not damaged or expired in any way, so it's good to use. And now I'm gonna do my first actual check. Okay, so this is for MR Wrightson, and fit is 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. Her date of birth is October 20, 1999. She has no known allergies. Medication we're giving is cloxacillin. Cloxacillin, dose is 1 gram. This is a 2 gram vial, so it's I can withdraw the dose from this vial. The route is IV. This is IV infusion only, and the time frequency of this medication is every 6 hours. Not giving it signed off for October 20th and at 0600, so I will be giving it. Okay, so now that I've done that, I can refer to a parenteral drug monograph. Okay, so this is cloxacillin, antibiotic, which makes sense because my patient has cellulitis, and it may be administered by a nurse or a student nurse, such as myself, and the maximum single dosage is 2 grams, and so we're only giving 1 gram, so we're well below the maximum single dose, and it is supplied as 500 milligram vials, 1 gram vial, and 2 gram vials. Over here I have the 2 gram vial. Okay, first reconstitution for my 2 gram vial, I need to add 6.8 mLs of sterile water for injection, so the final concentration will be in this vial, final volume will be 8 mLs in this vial, and the final concentration will be 250 milligrams per ml. And after that, for 1 gram doses, I need to dilute it for 50 to 100 mLs of normal saline. Over here I have 100 mLs of normal saline, and I can administer that over 30 to 60 minutes, so I will be administering that over 60 minutes because my patient it's my patient's first time getting this medication, and that's also why I'm diluting this over in a bigger bag, over 50 mLs, bigger bag, so it doesn't irritate my patient. Okay, and I do see it is compatible with normal saline, and so that's good to know. And some potential hazards with my medication can be diarrhea, nausea, and maybe a hypersensitivity reaction, so I keep those in my mind when I do my patient education. Okay, so the first thing I'll be doing is just doing hand hygiene before I get the rest of my supplies. I'll be just washing my hands. I'll be needing my sterile water. Here I have my sterile water over here. It's not expired, and it's not expired or damaged, so it's good to use. Okay, and now I'll also be needing my 10 ml syringe, a blunt fill, and some alcohol swab. So the first thing we're doing is just wiping the top of my vials for 30 seconds, letting them dry for 15. 30 seconds, letting it dry for 15. Okay, once I've done that, I'll just let them dry. Take my, I'll bring back my syringe and just attach my blood fill. And once I've done that, I need 6.8 mLs of sterile water. So therefore, I'll be injecting 6.8 mLs of air into my sterile water, and I know the top is clean because I just wiped it. I'm just going to be getting rid of all the bubbles. Over here I have 6.8 mLs, which is my correct volume for my sterile water. Okay, and now I'm just going to be injecting that right into my medication vial, and I know the top of my medication vial is clean because I wiped it already. And I'm injecting it into my 2 gram vial because that's what the parenteral drug monograph says. Okay, so now I'm just going to let the air drop back, and once I let the air drop back, I'll just scoop this. And then now I'm just going to be reconstituting my medication within my hands, making sure there's no sediment or anything in my vial. And once I know it's fully reconstituted, I'm going to be just calculating my dose since I need 1 gram, and the final concentration of each ml is 250 milligrams per ml. So therefore, I'll be needing 4 ml from this medication vial, and that is half the dose in this vial. Okay, so I'll just be taking the alcohol swab, wiping the top of my vial for 30 seconds, letting it dry for 15. 4 milliliters of air. Okay, I'm just gonna be getting rid of all the bubbles. Okay, I'm gonna be scooping that. Here you can see I have 4 mLs of medication, no bubbles. Okay, so I'm just gonna do my second check. Over here I have my tag already made. Okay, so the medication we're giving is, am I right in? The medication we're giving is cloxacillin, and this is cloxacillin, and the dose we're giving is 1 gram. And since the final concentration is 250 milligrams per ml, therefore I have 4 mLs of medication in my syringe. And the route is IV, and this is IV infusion only. The time frequency of medication is every 6 hours, not giving a signed off for on October 20th at 0600, so I will be giving it. Okay, so now once I've done my second check, I can put these in my MedWaste containers. Okay, and now I can pull out my mini bag that I'll be diluting it. This is a 100 ml bag of normal saline, and I'm just making sure it's not damaged or expired and it's good to use. Okay, and once I've done that, I'm just going to be taking an alcohol swab, wiping my port for 30 seconds. Wiping my medication port for 30 seconds. Okay, once I've done that, I can take this. I can inject that into my bag. Total full 4 mLs, and I would be putting this in a sharps container, but right now I don't have a sharps container near me, so I'll just be putting it on the side. Okay, and now I can just gently swirl this around in my medication bag, make sure it's fully diluted. And once it's fully diluted, I'll be putting my label on my bag, and I'll be doing making sure I have everything right. This is for Ricinema. The medication we're giving is cloxacillin. The dose we're giving is 1 gram, and the vial did come in 250 milligrams per ml. Therefore, I have added 4 mLs in this 100 ml bag. So our total volume in this bag is 104 mLs. And the route is IV. This is IV mini bag, and time frequency is every 6 hours, not given yet, signed off for at 0600 on October 20th, so I will be giving it. Okay, so now I've clarified everything. I'm just gonna be taking alcohol swab, and my pen and on my MAR to the patient's room, and my secondary tubing, which I know is not damaged, it's good to use. Okay, so now I'll be heading over to the patient's room, and upon entering the patient's room, I'll also do my entry safety check, making sure call bells and reach, patients are in distress, there's no tripping hazards, and patients are in distress, and that is the lowest position possible. Once I've done that, I can do hand hygiene, and then I can introduce myself to the patient. Hi, my name is Mohammed Kaushal. Today I'm going to be your student nurse, and before I start, can I just verify your ID with your armband? Okay, perfect. Okay, Ricinema, pin is 123, 123, 456, 456, 79, October 20th, 1990, October 20th, 1990, no known allergies. Could you please tell me your full name and date of birth? Ricinema, October 20th, 1990. Okay, do you have any allergies? Patient says he has no allergies. Okay, that's exactly what we have over here. Okay, Mr. Wrightson, I'll be right back. I'm going to be doing my third check by the bedside. Okay. This is for Ricinema, that's Ricinema. The medication we're giving is cloxacillin, and I did dilute cloxacillin here. Dose we're giving is 1 gram, and that was 4 mLs of medication, and I diluted 4 mLs of medication in a 100 ml bag of normal saline. Therefore, I have a total 104 mLs in this bag, and the route is IV. This is an IV mini bag, and the time frequency medication is every 6 hours. Not giving it a signed off for on October 20th at 0600, so I will be giving it. Okay, so now that I've done my third check, I'm just going to be doing some patient education on patient. Okay, Mr. Wrightson, I'm going to be giving you your cloxacillin today. Your cloxacillin is an antibiotic for the cellulitis you have. Some side effects you might experience regarding this medication are going to be diarrhea, nausea, maybe a hypersensitivity reaction. So if you do experience any of those, please use your call bell and call me. I'll be here to further assess you as soon as possible. And before giving this medication, I'm going to be doing full vital signs, and everything is good. Everything is in a good range for me to give this medication. I'm also going to be assessing your cellulitis on your left arm, and I just want to take this medication. The patient has given me consent for the medication. Okay, so now first thing we're doing is assessing the IV site. I'm going to be assessing the IV site, make sure there's no phlebitis or erythema on the IV site. There's no kinks in the tubing, there's no bubbles. Everything seems to be infusing perfectly. Patient's not complaining of any pain, and there's no signs of infection. I'm looking at my pump. My primary is running at 25 milliliters an hour right now, which is an appropriate rate. And I'm going to be looking at my primary medication. It is normal saline, which I know is compatible with my secondary medication, and the primary tubing and the bag has already been labeled by the previous nurse, so I know it's not expired. It's good to use. Okay, so now I'll be doing hand hygiene, and now I'll just be hanging up my primary lower than the level of my secondary. now I'm just going to be taking my secondary tubing, taking it out of the bag. First thing we're doing is just spiking my bag. I'm gonna be taking this off and then just dropping it, and then I'm gonna be uncapping my spike and then spiking my bag properly. Spike my bag, and then once I've spiked it, I'm just gonna put that cap down. I'm just gonna be hanging my secondary bag up. And once I've hung up my secondary bag, I'm just gonna be taking an alcohol swab. And I'm gonna be wiping the port above the Baxter pump because the secondary IV medications are supposed to be, secondary IV meds are supposed to be regulated. These medications are supposed to be regulated by the Baxter pump. So therefore I'm gonna be wiping this port for 30 seconds. And if I did touch this port while wiping it, I would have to re-wipe it. So I'm just gonna wipe it for 30 seconds, but for the sake of this demo, I'm not gonna be doing it for 30 seconds. I'll just drop that. And now I'm just going to be taking off this cap and aseptically attaching it. And once I've attached it, I'm just gonna be opening my port up, and then I can lower it below my primary, so to back prime it, and then just to get rid of all the bubbles in my secondary line, and it's half full. This is half full, so that's good. And now I can hang this back up. Now I can go to my secondary. And for the secondary, I do have a total of 104. I'm going to be running this medication as per my calculations over 104 mLs per hour, which is the total volume in this bag. 104 mLs per hour. So rate is going to be 104 mLs over total volume. No. Okay, I'm just gonna clear that. Okay. Total volume is 104 mLs. And this is going to be 104 mLs per hour. Okay, so I'm just going to confirm secondary and start. And I'm just going to be making sure all my clamps are open, and I'm watching for these 3 drips in my chamber. And the 3 drips have started, so I know it's infusing. And I'm just going to be making sure callback is on for my pump, so therefore I can come back within an hour, flush my secondary line with 15 mLs of normal sitting, so my patient gets the full dose. And I'm just making sure all my clamps are open and everything. And I'm also going to be labeling my secondary line, so the nurse knows when I put this with my name, initials, and date, so once you can change it. And once I've done that, I'm just going to be signing the MAR 0600 MK UMSN3. And after I leave the room, I'll also be signing the fluid balance sheet. And now I've signed the MAR. I'm going to be asking the patient if he needs anything before I go. Do you need anything before I go? The patient says no. And I'm just going to be assessing everything. Everything is infusing. And now I can do my exit safety check, making sure call bells and reach, patients aren't distressed, there's no tripping hazards, and bed is in the lowest position possible. And now I can go ahead and leave the room. That concludes my demo.